Hey agents, this is Luis Moreno with Insurance Agent Training. I got an email from an agent asking a pretty good question on Medicare and having group insurance, which one is better. Let's look at her email and then I'm going to show you how I replied back. So this is her email that she sent to me. Email says, "Hey, I'm running into people that are retired and come from jobs where their existing insurance, which they're paying for from their pension plan. So they're keeping their insurance from work. And I'm assuming it's just their regular insurance. It's not a retirement plan, or maybe it is. But I'm just going to make the assumption here that it is their group employer plan that they had while they were working. Okay, now, a lot of times when you retire from a company, they provide you a retirement package with Medicare options. Well, that's completely different. This right here is, I'm assuming they have they have the group insurance from work. Is it benefiting them to be enrolled in a Medicare Advantage plan and their keep their previous insurance coverage? Okay, so let's get into how I would explain this. Before I do that, guys, I want to do a couple of things. I want you guys to comment, like, and subscribe to the channel. I need a little help here. You guys would like it. It gets shared with more people. Put comments, I reply, and maybe give me your feedback. I don't run into a lot of people in this scenario. Maybe you guys know a little bit more than I do, and I'd love to hear your feedback. And then, guys, I'm almost to 8,000 agent subscribers. I would love to have your support. All right. So, how would I reply? Well, the number way I would reply is it pretty much becomes a math equation. So, let's say that they have Part A. They're 65, so they have Part A, and maybe they don't get Part B because they have that employer coverage. Well, that employer coverage is not free. Okay, so the employers usually will pay 50% of the bill. And I'm going to take just an average number here that for a 65-year-old, the premium for a middle of the road, maybe a silver plan within a group scenario is maybe $800 a month just for the employee. And the employer's paying half of that. Okay, but when they're retired, that employer probably is not paying anymore. It's my guess. Okay, remember, I don't have a lot of information to go on. So maybe they're paying $800 for that plan. All right. Now, so we got to factor the $800. Now we got to factor that plan. It has a deductible. It also has a maximum out of pocket. Okay. Probably is a PPO, nice plan, but they're going to pay the $800 premium. They're going to have to pay the deductible, and they're going to have to meet the out of pocket maximum. So you put all those numbers on one side. Okay. Now, she did state Medicare Advantage. So let's go to Medicare Advantage side. So if they let that go, they're going to save the $800, and they're going to save for medical the deductible and the max out of pocket, whatever that may be. Maybe $2 or $3 grand on the deductible and maybe 8,000 and change on the out of pocket. Okay, now we go to the Advantage plan. So they're going to have to enroll in Part B and pay that $185. It's going up to $205, I think. So let's just keep the numbers around $200. So $200 for that Part B. Now we have to do a Medicare Advantage plan. Well, most of these Medicare Advantage plans are zero. The HMOs are zero. A lot of PPOs are zero. Okay. They also have max out of pockets. I saw one PPO with a $350 Medicare or medical deductible, super cheap. Okay, and it was only for certain things, not for, well, very similar to the way it is in the group plan, but for a $0 premium. So there is an advantage there. Now, back in the day, 2024 and prior, I would be like, all right, let's look at the meds because we had that donut hole to deal with. Well, we don't have that donut hole anymore. It was taken away in 2025. So we can literally take that off the table. We just got to make sure that the doctors and the prescriptions are in whatever Medicare Advantage plan. So it's going to be a win there. All right. Now, if we go to another option, which is adding a Medicare supplement with a prescription drug plan, Now, I think we've made this maybe a little more cost monthly, but still less than what they're paying for the group plan. But now check this out. Med Supp premium. Okay, I'm going to assume this person is 65, but let's just go with a roundabout premium of 150 bucks, and I'm probably aiming high. And let's go with a PDP plan of maybe 60 bucks. I'm at 200 and change. All right. Well, 200 and change, maybe let's go to 220. So I take the $205 Part B premium plus the 200 and something dollar premium for a Med Supp and a PDP. I'm at 400. $400 versus the 800 that they have with their group plan. I already won there. But where I'm really going to win is on the medical side, because with the group plan, they have the deductible and they have that max out of pocket. On the plan over here with their Med Supp, all they got to meet is that $255 Part B deductible, and 100% of their medical is covered with no network. Okay, no referrals. Already won there, so it's a no-brainer. Put the PDP in there, make sure their meds are covered. Yes. So the answer to her question is more than likely going the Medicare route is a win for the client. It's also a win for you as the agent because you're going to make some money. But I would definitely entertain the Medicare Advantage plan, entertain the Med Supp with a PDP. And if they are coming off credible coverage, this will be the only time that they can get into a Medicare supplement without underwriting questions. So definitely consider that if they're coming in with some pre-existing conditions, okay? Because they'll never have that guaranteed issue window again. So hope that explanation helps out there. Do me a favor. If you have a different view on this topic, I would like to hear about it. Put it down in the comments below. I'll follow up with you, okay? And maybe you have a different take on this. Maybe you've dealt with this different. So let me know. I'd be glad to help. This is Luis Moreno with Insurance Agent Training. Hey, down below, guys, a couple of things. Okay, number one is I've got my Medicare and my ACA Smartbooks. They're insurance manuals. I update them with all the information that you need so that you don't have to hunt for it. You buy it once and you never have to buy it again. Every year that I update, you get them. Secondly, and I'm having a ton of fun with this is one-on-one coaching. Okay, if you want to book a half hour, a 1 hour book of time with me, you want to discuss whatever. I run a P&C agency, a health ACA agency, Medicare agency. Been doing this for 25 years. I got about 14 employees. I got agency producers. You name it. Whatever you want to talk about, creating an agency, I have over 800 downline agents. You want to create a downline. You want to talk about growing your business, marketing, you name it, staffing, payroll. Hit me up, guys. I would love to help you out. Book an hour of my time or a half hour, and I'll give you everything that I got. I will not hold anything back. I've also got some more goodies down below. Okay, I've got my agent CRM, which is the best CRM to use. I've used many of them, but these guys have an incredible CRM. And if you use my link, you'll pay the same price, but you'll get all the workflows that I've created for ACA, Medicare, Life, P&C. You get it all, guys. So take advantage of my link. Also, if you want to do some marketing on social media and you don't know how, I partnered up with Shauna. She's really good at helping agents with marketing. Consider a course, Learning How to Advertise on Social Media. Click down below. You get access to her course. It's really good. All right, guys, Luis Moreno with Insurance Agent Training. Make sure you comment down below. Like this video. Give me that thumbs up so it gets shared. And don't forget to subscribe to my channel. Thank you.